For too long years, society has been faced with an aggressive narrative that says, wear this, do this, stop this, and you must comply with these things if you're a, quote, good person. It's morally reprehensible not to protect children at all costs. See how that gets convoluted? What exactly is at all costs? Today in part 1 of a series, I'll be exploring the success and failures of non-pharmaceutical interventions, NPIs, to actually prevent COVID-19 mortality. The first NPI we'll discuss is face masks. Should you or your kids be wearing these at all?
On today's episode of Return to Reason, the failure of NPIs.
They seem pretty innocent and harmless, right? After all, it's just a mask. The problem is the messaging from authorities wasn't balanced. All ability to critically think and do your own personal risk assessment was removed. Why is it that wave after wave of cases, they seem to dig their heels in deeper about masking? It begs the question, is the mandating of masks about protecting your health? Or is it about demonstrating your compliance? Let's take a box of these masks right here. It says right here on the top, this device does not protect against biohazards, bacteria, and viruses. Well, that's the baseline we're working from. Respiratory droplets, carrying infection or not, are characterized by size. COVID-19 is primarily transmitted by aerosols.
We're talking about these droplet nuclei and small water droplets. Scientific studies before this pandemic have shown that low-cost masks, and so we're talking about surgical masks and the cloth masks we're wearing, these low-cost masks have pore sizes that range between 80 and 500 microns in size, so a huge range, right? The diameter of the virus is 1 micron. The largest possible small droplet that would comprise a typical aerosol and 2 viral particles is 62 microns in diameter. So I just want to put that in perspective. The smallest pore size is 80. So that means the largest droplet coated with the virus can pass right through.
Dr. Paul Alexander is an epidemiologist focusing on evidence-based medicine and research methodology. He has a master's in epidemiology from University of Toronto and a master's degree from Oxford University. In a recent article for the Brownstone Institute, he laid out 167 scientific citations for the ineffectiveness of masking the general public. It is not unreasonable to conclude that surgical and cloth masks, used as they currently are being used without other forms of personal protective equipment, have no impact on controlling the transmission of COVID-19 virus. Current evidence implies that face masks can be actually harmful. The body of evidence indicates that face masks are largely ineffective. An Alberta chiropractor, Dr. Curtis Wall, was taken to court by the College of Chiropractors of Alberta for, quote, unprofessional conduct when he could no longer wear a mask while working due to his medical condition. Lawyers on both sides listened to hours of expert witness testimony outlining the use of masks, potential harms, and their effectiveness to curb spread. Here's one highlight. A cluster randomized trial in rural Bangladesh capturing the results of over 300,000 adults and the largest, most comprehensive study to date released the following findings in April 2021. Villages where everyone wore a surgical mask had an infection rate of 0.67, and villages where everyone was unmasked had an infection rate of 0.76%. Let's put that in relatable terms of your Canadian chiropractor's office. The court transcript reads, at those rates, 8 weeks of mask wearing by all of Alberta's 1,100 chiropractors would only prevent 1 infection. Not 1 death, 1 infection. Is masking kids all day an effective way to protect them from COVID? Is it to protect the adults who they come into contact with? Who is protecting whom? How much of forcing healthy children to wear masks is political theater? On March 16th of this year, Washington, D.C. became one of the very last major metropolitan areas in the U.S. to finally end mask mandates for students. However, this lifting of the mandate doesn't necessarily mean schools are mask-free. One D.C. parent of a private charter school says they see no end in sight to the school's internal masking policy, regardless of what the local government is saying. Our principal told us that right now, masks are still required indoors for all students, says one mother. Students only gained the right to go maskless outdoors as recently as March 28th. They wore them during sports. Even outdoor track was masked, reported another mother. The frenzy around masking doesn't seem to answer to common sense. The World Health Organization's recommendations for children typically errs on the side of caution. Even the WHO says children do not need to wear a mask when playing sports or doing physical activities such as running, jumping, or playing, as it may affect their breathing. In the summer of 2021, a group of parents in Florida got together and paid a lab to analyze their children's masks. The kids were given fresh masks at the beginning of a school day. The children wore the masks for one school day as they normally would. The masks were put into a bag and frozen until they could be collected by the lab for analysis. The findings were shocking to this group of concerned parents, so much so that they published the results in their local paper. 96 unique strains were detected from familiar pathogens such as strep, tuberculosis, meningitis, E. coli, and staph. None of the pathogens on the masks were COVID or a virus of any kind. You can look up these findings online for yourself. This is not a peer-reviewed study. It was small in scale and only revealed some preliminary data. Dr. Kari Basso, director of the Research Lab and Education Center at the University of Florida, explains.
The problem is that it's very difficult to go forward with these studies. Nobody wants to, for one thing. They're afraid. And the other thing is that it's really hard to get an IRB. Anytime you do research on humans, you have to get IRB approval, which is Institutional Review Board. And they review, because we can't just go crazy on experimenting on humans. And so there's rules and stuff. And an IRB won't approve a mass study of children because the masks are, they're considered harmful.
I can't think of anything more condescending than reducing infection control to a parroted mantra, as if all of society needed to be treated and disciplined like children. But let's just say masks do, in one way or another, reduce the amount of COVID infections. Not deaths necessarily, but infections. Are they worth it? A research paper entitled Physiological and Psychological Impact of Face Mask Usage During the COVID-19 Pandemic tells us each patient wore a new N95 mask for 4 hours during their dialysis session. 70% of patients showed a reduction in partial pressure of oxygen, and about 19% developed hypoxemia, which is a term for low levels of oxygen in the blood. Hypoxemia can cause headaches and shortness of breath. In severe cases, it can interfere with heart and brain function. I wonder how long it'll take before the reduced productivity of masked workers will even be studied. Dr. Byram Bridle, an associate professor of viral immunology at the University of Guelph in Ontario, has been censored and ridiculed for his common sense and highly qualified scientific analysis repeatedly. His comments have been at odds with the approved narrative on COVID public measures in Canada. In a written article which all parents should read for themselves, he says. An unfortunate and underappreciated long-term legacy of this pandemic will likely be a cluster of pandemic youth that grow up to suffer higher than average rates of allergies and asthma. This will hold true for children in all countries that enacted isolation policies. Raising children during the pandemic has largely occurred in isolated, sanitized environments that are unprecedented in extent and duration. These kids are at greater risk of developing hypersensitivities and autoimmune diseases than anyone before them. Presenting unbalanced data and arguments to the mask question would be oversimplifying things. You deserve to know that some scientists do think there is sufficient evidence to say face coverings may help curb spread of COVID-19. Not stop transmission, but help slow the spread from person to person. Causation and correlation are up for debate. Does wearing a mask remind those around you to maintain social distancing? And do surgical masks prevent large droplets from a cough or sneeze from traveling so far? Maybe so. If wearing a surgical mask for hours on end didn't cause any harm or any reduction of proper airflow, a case could be made for their use on symptomatic people. In March 2020, right at the beginning of the pandemic, in an interview on 60 Minutes, Anthony Fauci himself said, "When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet. But it is not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and touching their face." After everything I've highlighted today, let me be clear. It is absolutely your choice to wear a mask. If it makes you feel safe and protected, go for it. My goal today was simply to prove that if the authorities felt it necessary to mandate we all wear masks to protect society, then they owe us the honest and open truth about the possible side effects and the possible benefits, however negligible. The former wasn't advertised, and the latter was totally misrepresented in the media. The results were society believed a lie, and that lie is still being propagated by governments and health authorities. Now that's something to consider. How much of the pandemic narrative gained momentum purely based on the virus of fear? It's very hard to admit you made a wrong decision or a bad decision for your children. Even harder is the will to change a behavior based on new information, especially if you fear social rejection. And the hardest task yet, to stand up to authorities by voicing your concern. Wearing a mask should be a choice, and the least we can do is make that choice after being informed.